Here we go. The day has arrived.
Hello, this is the video message for you guys. I'm here at the surgery center. Looking fabulous. Feeling fabulous. Alright, how much more? Alright, redo it. Restart. Alright, restarting. Talk to you later after surgery.
I am gonna have Clayton come on here, the one that actually had the surgery, and tell y'all about his experience and how he felt. But I'm gonna give y'all my perspective from taking care of him, from the caregiver role, from someone that's dealt with that surgery. Tell you what I've seen and what he's been expressing to me about how he's feeling. As soon as he got in the car from the surgery, like right after it got done, he was feeling very nauseous. He felt terrible. He never gets car sick, but he felt super car sick riding in my car. And it felt like he was just trying to hold on to keep himself from getting dizzy. Clayton has expressed that the pain medicine gets out of his system. He's really going to be in excruciating pain. He said as soon as he got out of surgery, his throat was hurting him tremendously. I'm just going to ask you a couple questions. Yesterday is when you had your surgery. What did you feel exactly as soon as you got out of the surgery?
I was really loopy still from the
anesthesia.
Yeah, the anesthesia. I was just sick. Felt like throwing up. But my nose felt clear and I could breathe better instantly. That's kind of what I felt when I got in the car.
Today is the first day after surgery. What have you felt today?
More so than yesterday. My nose isn't draining as much. Instead of draining, it's more just clogging up with blood instead of that blood draining.
What all did you have to eat or drink yesterday, first day, right after?
I didn't really have much other than I had a fruit smoothie. That's pretty much it. Just a fruit smoothie periodically throughout the day, just to get something in my system when I would take the meds.
Did you have an appetite?
Not at all.
And what have you eaten so far today?
Applesauce, Pedialyte, water, a yogurt, and that's about it.
And how's your appetite been today?
Still not really an appetite.
How are you feeling? Are you feeling tired?
Yeah, the pain meds are definitely making me feel tired.
Can you explain what you have on your nose?
Yeah, so it's this thing, make it so that if the blood drains out of my nose or if I sit forward, blood will drain and then it'll land on that thing. So it just keeps me from getting blood all over. It also keeps me from messing with my nose. Then it kind of reminds me that it's there.
How did you sleep last night, the first night after surgery?
I slept pretty good. Whatever it's called wore off.
Anesthesia?
Yeah, the anesthesia wore off. I don't like taking pain meds, so I was doing half dose, and then once they wore off, that half dose wasn't enough, and I could really feel the pain.
Now, some people during the surgery, they bleed a lot during the first week, and they even throw up blood. Have you experienced any of that?
So the first day I was bleeding. Anytime I sat forward, I instantly had blood draining. In a way, I wish it was draining more, but it's not really draining. It's just kind of sitting in there stuck. So I can't breathe through my nose right now.
Is the recovery day one so far what you expected it to be, or is it a lot better?
It's what I expected it to be, but I expected more drainage, less clogging. I'm glad I'm not getting sick from the pain medication.
Do you normally?
Yeah.
And you're taking hydrocodone.
Yeah.
Describe your sickness that you usually experience with hydrocodone.
Anytime I sit up, I'll get dizzy, and then if I stand up, I usually feel like puking. This is what I felt when I first got in the car.
So have you felt nauseous since?
Since the surgery? Yeah, I felt nauseous at times. Getting up out of bed and going to the bathroom and things like that, I feel nauseous, yeah.
So one of the medications he was prescribed is Piperacin. Another name from it is Bactropin, nasal swab thing that we're going to do. This is an antibacterial medication, so it's going to help prevent bacteria from growing inside his nose. He applies this inside the nostril that the incision was made on, which is his left nostril, and I'm going to show you how he does it.
Want to hold the thing for me?
You want me to hold it?
Got it.
He applies this 3 times a day for 2 weeks. Just go inside, barely, gently get it in there to make sure no infection grows inside the skin of his nose. We can see the Q-tip after. There's a little bit of blood after that application. This thing that he had around his nose that was holding little gauzes. The doctor said he doesn't have to keep that on past today. That's basically just to keep him from bleeding out, and the gauze pads obviously collect the blood in there. Most people do bleed a lot more. Luckily for Clayton, he hasn't experienced a lot of bleeding. He is experiencing bleeding, but it's not so severe that he necessarily needs to wear this. Every time he gets up or moves around, that's when we've noticed him to start bleeding. But if he's laying here calmly and just relaxing, then his nose is not really bleeding. He can feel it bleeding on the inside, but only a tad bit comes out on the outside. These are the medications, and these are the gauze pads that you will use and be prescribed right after surgery. You can click on the link below or the link above to watch the video on the amount of each dose that he has to take of each medication and how to use each medication. And there's also a video attached below of how to use this specific Neomed sinus rinse. Since I'm the one here helping Clayton with his recovery, I want to make sure I was absolutely organized with his medications and that he didn't miss a dose whenever he needed to take it, so the medication stays in his system and it helps him with his pain and relieves his pain and his nausea. I created this chart to help keep track of everything. This is what the chart looks like. And I just put each medication up here. The only medication I didn't include was the anti-nausea med because it came in these. So I just wrote the times down and the date every 4 hours as needed over here for his anti-nausea meds. So I just wrote the date, check mark when to take it, and then date and time of every 4 hours here, check mark to complete this ointment treatment, sinus rinse check mark, and then same with this. 2 to 3 pumps. This is night 1. Clayton was able to eat a bowl of a super small bowl of white chicken chili. White chicken chili. Is it a soup or is it a white chicken chili? Here we are. Here's Clayton. His eyes are hurting that much from the light right now. He's not following instructions very well since he is supposed to be on bed rest for a full week. Since Clayton hasn't been wearing his nose mask piece thing that he was wearing yesterday, he's been accidentally hitting his nose a lot today. Something had to be done so he wouldn't keep doing that, right? Well, you see these wonderful gloves on his hands. Got him in a FabFitFun box, one thing, and it came in a pack of 2, and I used one and I loved it. It made my hands super soft, but I put him on his hands so he's not trying to hit his nose or he's thinking about his nose, or if he does lightly tap his nose, then that can like kind of warn him before really getting to his nose. How did you sleep last night?
I slept okay. I felt like I woke up a decent amount.
Were you able to eat more today than you were yesterday?
Yeah, I was able to get... So last night I was able to get down a little bit of chili, and then today I was able to get down some vegetables, and I wouldn't say much more than yesterday, but I felt okay eating it, and I wasn't nervous that I was going to throw up or anything like that.
What has your day yesterday and today looked like? Your schedule?
In terms of what I'm doing, this consists of a lot of laying around, staying elevated, keeping my shoulders elevated as well as my head, so that my head's not up like this, but it's like all elevated together. I'm just laying around. The pain medication has me really drowsy, so I'm just kind of a lot of napping, trying to let it rest, settle into place correctly.
Are you seeing any progress from yesterday?
In terms of what, anything?
Like, are you feeling anything better symptom-wise?
I don't feel as nauseous.
So you hit your nose in your sleep last night?
Yeah, so pretty much the pain medication starts to wear off, I noticed that then I'm wanting to touch my nose. It's like time for me to get my next dose in. It's almost like my own alarm goes off and it's me touching my nose. I did that last night and I felt a stitch for the first time. Because last night when I hit my nose, it woke me up, and then I went to the bathroom, and then I kind of looked in my nose and I could see a stitch.
What has been the worst part of this so far?
Really just having to just not do anything. Just lay and just really taking the pain meds. If I don't take the pain medication, then I move a lot more, and then I fill up with blood a lot more. Today I've been feeling pretty good, a little bit more airflow. Although I've had pain in my right heel, on the back of my right heel from it rubbing on the bed so much, so now I have to prop my feet up more because it's pretty painful. Slept okay.
Are you feeling better once you rest than waking up?
The rest just makes, I mean, laying down and resting just makes it so that I don't move around, so that there's not a bunch of blood getting clotted up in my nose. So I definitely feel better when I wake up versus if I'm walking around, because if I'm walking around, then I'm all stopped up, and if I, rest and lay down, then, there's more opening.
Do you feel the swelling inside your nose going down?
I don't know about swelling necessarily. To touch it, it still feels swollen, really swollen, but it doesn't feel like there's as much blood in my nose. I mean, there's definitely still a lot of blood in my nose, but it doesn't feel like as much.
Would you say you're gaining more energy by each day?
Yeah, definitely. See, just doing this, like, I can feel the blood starting to clot up in my nose. So I just have to not do anything, try not talking a lot, and just laying down and doing nothing, really.
Can you breathe better though?
All I feel is pain.
Just in your nose?
Today, Clayton had his follow-up appointment. PA and the surgeon cleared his nose and cleaned it and got all the crust out. He's been feeling the stitch inside of his nose that the incision was on, and it's been like hitting the side of his nose, which has caused him a little bit of pain, and honestly didn't feel good, and it was very uncomfortable. This morning, he's not so much in pain, but more so it's just a very uncomfortable feeling. The surgeon said that today all the blood and drainage should be draining down his throat or either clogging up in his nose. He just had a little bit in his nose. They sprayed this solution inside his nose to numb his nose in order to be able to get all the crust out. He felt very nauseous after it, had to lay down. He felt like he was almost going to pass out. The surgeon also said that he will be able to return to work in 1 week. Today he took his last dose of his antibiotic. He stopped doing the Afrin spray since you're only supposed to do that up to 3.5 days. Otherwise your nose becomes dependent on it. It could make the nose drainage a lot worse. He also finished his last dose of pain medication and anti-nausea medication. So the only things that he has to do on his medication schedule to do the nasal rinse and the mupirocin nasal swabs.
How are you feeling right now and why?
I'm feeling kind of weird. I don't know. Like, when I went to the checkup, they shot a bunch of stuff up in my nose. That's all I can taste or smell. So it's just like making my stomach hurt a little bit.
In what way?
It just hurts.
What else?
I just feel weird. A little nauseous, a little dizzy.
Do you think it's because
Stopped
you're hungry?
Maybe.
Eaten anything today?
Just a smoothie.
How did you feel before the doctor's appointment?
Out of it.
This is the saline nasal rinse, the Neomed rinse. He has to do twice a day for 2 weeks. He has to do half the bottle in one nostril and half the bottle in the other nostril. Once he pushes it in one nostril, it drains through the other. Today is day 5. Clayton has had a headache yesterday ever since we left the follow-up appointment with the surgeon. It looks like it just appeared back. He is not feeling well at all. He feels super congested. The surgeon said that that is expected the first week after surgery, but it's still very annoying and uncomfortable feeling. How are you feeling over there?
Terrible.
Is it just your head that hurts?
Yeah.
It looks like you gained your appetite back though, right?
No, I'm forcing it.
How do you feel after you eat?
Well, I just ate and right now I feel terrible.
Did you wake up with a headache?
No.
That's going to be it for this video. I just didn't want to make it super long, so I'm going to cut it into 2 different segments. So be on the lookout for part 2. If you are new to my channel, make sure you hit that subscribe button, turn on your notifications, and I'll see you next time.